Good morning, Dr. Patino here at the Cosmetic Surgery Facility. We're going to do micro-power assisted liposuction. This is like an electric toothbrush. You see, I turn it on and it vibrates. You don't have to be going back and forth at full force like it was not an electric tool, because otherwise you will have bleeding, right? So gum bleeding when you brush your teeth, and in this case here, you would have bleeding, of course. So look how gentle I am. I let the instrument do its work, and we're gonna see pretty soon what comes out, right? But this is the way we do it here at the Cosmetic Surgical Center of Torito. So it's just very gentle aspiration. Can you already see what's coming out on these or no? Can you show?
Yeah.
It's probably just a little bit just now, but this technique is very unique, I would say. It's nothing that is a secret or anything like that. Every surgeon knows about the tumescent anesthesia, but the important thing is to apply plenty of the tumescent anesthesia in all planes, and to wait. We waited almost an hour in this case before we start, and also to go slow, because this is like pretty much like driving a car, you know. If you go slow, then you can still crash, but chances are less likely that you will die, right? If you go very fast, you can go into an unintended area, you know. And same here, you know, tire surgeon on a
Action.
yeah, so much like driving a car, you know, a very tired surgeon on a Friday afternoon after doing many cases, you know, he can go very, very fast probably and go to an area where he didn't intend to, and so cause abdominal or intrathoracic organ perforation, something that has never happened to us. But I would say that doing this procedure the way we do it, very slowly, we do 1 or 2 cases per day at the most, then, you know, the risk is less, right? And so we never had that problem. But in addition to that, look at the beautiful yellow aspect, right? And he is not going to have a fat transfer or anything, but we still like to have this yellow aspect because there is much less risk of anemia, if there is less bleeding, less risk of hematoma, less risk of infection. So the patient is not going to be tired the next day, and because we use this tumescent anesthesia, he's not going to have much pain. If he doesn't have much pain, he's going to be woken. If he's going to be woken, he's going to prevent the most lethal complication, which is that of a blood clot. That's the one thing that can kill you, and thanks to God, we never had anybody die, and we want to keep it this way. Thank you. So we're halfway in the abdomen, and notice how that output is still beautiful yellow fat, right? And without any bleeding and without any oil, you know. When you do very fast, aggressive liposuction with big cannulas also, you can disrupt the fat cell and the oil leaks out, and then you end up with oil. And in this case, it's not a big deal because we're gonna throw this fat away. But if you were going to put this fat in the breast or in the buttocks, and you're putting oil in there, or you're putting fat in there, the body will reject it. And it will be like a foreign body reaction. Like if you have a bullet or a piece of glass, the body is going to create a callus around it and push it out toward the skin. And those are the famous oil cysts that people get usually in the buttocks, which we never have. And maybe even the blowout fractures, that is like an out, like a light bulb basically that sticks out, you know, in the bottom. And we also never have that. and that's also, you know, usually is the destruction of the anatomy of the buttocks by aggressive cannulation. But I also believe that is the result of the body rejecting that blood that is outside the blood vessels where it's supposed to be, right? Similar to when you have, say, a breast implant that you form a capsule around it. And yeah, when you have a breast augmentation, for example, you put a breast implant and the body forms a capsule around it, and that's normal. But if there is any blood around that implant, the body rejects that blood, which is foreign to the body because it's not where it's supposed to be. It's not inside the blood vessel. So it's irritating to the tissues and irritates, and it causes a foreign body type like reaction. Those are the famous capsular contractures. And by the way, when we do these procedures, the risk of capsular contracture is less because we usually do it with minimal bleeding, and also because we usually do it with a tiny incision far away from the breast in the belly button. So that also helps. Thank you. This technique also has advantages for the surgeon. For example, now I'm using my non-dominant hand. And so I still go slow and therefore avoid repetitive injuries to my wrist, elbow, or shoulder in the form of tendinitis. Thank you. Alright, so we're almost done. We're doing high definition liposculpture on this male, and notice how the output remains nice and yellow, right? Yellow pot, and I'm using my left hand. So this has advantages for the surgeon as well. What the advantage for the surgeon is that I can switch hands and I don't have to be on the same hand or the same arm, and the repetitive motion could cause injury to the surgeon, like tendonitis, occupational injuries. So tendonitis to the wrist, to the elbow, or to the shoulder. Or all of them, right? So when you do this procedure, and if you do many of them, eventually that's going to happen. But if you switch hands, you can probably decrease that probability to maybe improve it by 50% when you switch hands. And especially when you do this procedure the way I do it, which is very, very gentle, very controlled, strokes, and very slow, then you can even decrease it even more. So the advantages, to recapitulate for the patient: less risk of anemia, less risk of bleeding, less risk of hematoma, less risk of infection, less risk if you're going to do a fat transfer of oil cysts or the famous blow-up fractures on the buttocks, and less risk of probably also deep vein thrombosis, because these patients don't have much pain because they have full tumescent anesthesia for 2 days, so they're going to be walking and they're going to prevent the most lethal complication, which is that of a blood clot. We never had that problem. We've never had anybody die, thanks to God. And so we want to keep it that way, right? So the best way to prevent a blood clot is to walk, and because our patients don't have much